And welcome back. We are talking about lupus, a disease that impacts African Americans and women at a greater degree than anyone else. And we had, as you know, in our first half, some experts on, a doctor who talked about what lupus was all about and a patient of lupus. Now we are bringing to the table Tracy Rohde, who is the president and CEO of the Lupus Foundation of America, the Mid-South chapter
Yes.
here. And regionally, you've been dealing with lupus and, of course, looking at some of the things that the impact that lupus has had in our area here.
Yes.
But thank you so much for being here. And if you could just start with a little bit, as I said, of the things that might be happening here in Middle Tennessee in particular,
Okay.
even though I know you've got some other states that are under your belt, about making sure people understand what lupus is, that they know about the disease, that they know the impact of what's happening on our population here.
Great. Thank you so much, April, for having us here. Really, it's stunning how few people know about lupus. It's not a household word at all.
Yeah.
I'd say it's an underpublicized disease. And although we have 35,000 Tennesseans who have a definite lupus diagnosis, as Dr. Barnadoe said in the earlier segment, you have an average of 6 years to get from the onset of symptoms to diagnosis. So if you think about the lupus patient being in a continuum from onset through the symptoms going away, hopefully through an experience with remission, then you could have double that number. So we have people who are concerned about symptoms. They're even unsure which physician to see.
Yeah.
We're so fortunate here in Middle Tennessee at the wealth of healthcare options that we have, but throughout our service area, we have folks who may have to travel 30 or 40 miles just to see a physician at a walk-in clinic who may or may not have experience treating lupus patients or diagnosing the disease. So with a really concerted effort to reach those people where they're already seeking advice and support, their churches, their social groups, school counselors. We're really embarking on a huge outreach effort to try to get people information about the disease. Some of the symptoms that almost all lupus patients experience, like fatigue, joint pain, those are symptoms that are common to
Across
so
the board.
many. I mean,
Yeah.
and just, you know, we're doing too much. I'm middle-aged. I'm tired right now. But with people knowing that they are more likely to develop lupus because of being an African-American woman, maybe having lupus in the family, that helps them say, okay, I need to not ignore this. And it's because it is so difficult to diagnose lupus. If you add in a period of time where the patient is not seeking intervention for the symptoms that they're experiencing, you can see where that stretches a 6-year average out to 12 or 15 years. It is not uncommon at all for us to get a phone call in the office from someone who has been trying to find a physician that would say, this is what's wrong with you, for 12 or 15 years.
And it sounds like, obviously, the churches and congregations is a great route because there are all sorts of health screenings that happen on a yearly, sometimes bi-yearly basis in churches. But as we heard from Rashara's story, it also seems like there needs to be some education among our physicians and doctors so that they know what those symptoms are and they don't look so common to them. But they actually get them to a diagnosis of lupus. So how do you get there?
That is absolutely true. That's something that our national organization is looking at is, you know, on the local level, we can do a lot to affect the individual patient. But for big sweeping policy changes that are really going to impact how lupus is treated and managed in the future, that's why having an organization with a national headquarters is very important. So we're looking at ways to implement more training in medical schools. How can we as an organization provide continuing education into different types of specialty so that physicians will actually have the information about that. Also, as Rashara shared, nurses are really the front line often of healthcare and of diagnosis and helping patients navigate not only the physical symptoms but just the emotional and the logistical management of a disease. So, you know, something to look at in the future is in the way in the oncology world, nurse navigators help patients manage care from diagnosis through the completion of their treatment. That's the type of thing that could happen in the rheumatology world as well, but obviously that's the type of situation that would be more likely to happen in a large city that has medical centers like Nashville, Louisville, Birmingham, Memphis.
So you obviously have paid attention to the Kelly report, the congressional report that just came out about the disparities of lupus, and also I understand have a role as far as trying to help bring some attention and some focus to the opportunities we may have here to make a difference on that report, on what Congress is doing, on some dollars as far as health are concerned. Talk a little bit about those actions.
Our national CEO, Sandra Raymond, was actually one of the contributors to the Kelly report. She's been at our organization for nearly 20 years and is obviously a national expert on lupus advocacy. Part of what the Kelly report speaks about is how difficult it is to develop drugs for lupus. We've said before, it's a moving target. It's so different.
You have to have different medicines to treat the different symptoms,
Absolutely,
correct?
And it's different in different patients. So the very core of scientific research, and most people know about clinical trials, is having a control group of people who are as similar as possible, having as similar symptoms, and then taking a similar drug. With lupus patients, you have so much diversity within the disease, even within an individual patient. The attacks of lupus are called flares. So one flare may be the type of thing that makes a patient stay in bed for the weekend. The next flare may have them on life support in the hospital. And it's impossible to predict. So you can see where the types of regulations that the Food and Drug Administration would have put in place for drug development might be a little bit difficult for lupus researchers to actually make sure that it's the drug that's making an impact on the patient's outcomes, not just some change in their immune system that's happened organically without medication. So the 21st Century Cures legislation passed the House recently. Our organization was instrumental in having that happen. We have, of our 9 Tennessee congressional members, 4 of them are part of the Congressional Lupus Caucus. So we have in Tennessee some very strong voices. The same is true in Kentucky and Alabama. And then the companion legislation for that in the Senate, Senator Lamar Alexander is actually one of the authors of that report that is they're basing that legislation on. So we do have some strong voices, not just for lupus, but for saying, let's change the way that we bring new medications, that we do research, so that physicians actually have a chance to get new things into the hands of patients and physicians more quickly.
Tracy, we have just a few seconds left, but what can people do if they want to help? We'll give them some information, some contact information, and all that good stuff.
Our website is lupusmidsouth.org. Again, we serve Alabama, Tennessee, and Kentucky. We really focus on not only educating patients, but providing information about things that they can do themselves. Good nutrition, fitness, stress reduction, even some things like journaling and doing art and things like that. We're planning a big conference in December, Saturday, December 12th, called Living with Lupus.
And we'll make sure that we put that information on our site and also get everybody to that site as well. Thank you so much for being with us.
April.
Thank you for joining us. We'll see you again next time.